Hello, I'm Dr. Sundari Mase, Sonoma County's health officer, and I'm here to share the latest updates on coronavirus in our county with you. Here's my report on cases as of yesterday, August 16th. We have 4,377 confirmed cases, 1,724 are active, 2,596 have recovered, and we now have 57 deaths, 3 deaths reported in the previous 24 hours. Now we've done a little bit over 88,000 coronavirus tests. We want to talk a little bit about the heat now. We just made it through a hot weekend, and there's another very hot week ahead of us. I want to share some tips about how to deal with the heat and what signs to watch out for. The National Weather Service has issued an excessive heat warning for Sonoma County for today that will be in effect until 9 p.m. tonight. A similar warning is expected to be issued for Tuesday. A high temperature can cause stress on our bodies, but also on our minds. When the heat becomes too overbearing and there's nowhere to go to cool down, one may experience heat exhaustion or even worse, heat stroke. Cooling stations have been set up for the early part of this week in many areas, including in Santa Rosa, Petaluma, Healdsburg, and Sonoma. Most will be in operation from roughly 11 a.m. to 7 p.m. We encourage members of the public to take advantage of these centers if they find their health is at risk due to the high heat. Please know that face coverings will be required, as will COVID-19 screening when going to a cooling center. Heat exhaustion is a milder form of heat-related illness that can develop after several days of exposure to high temperatures combined with dehydration. The people most at risk for heat exhaustion are the elderly, those with high blood pressure, or anyone who's working or exercising in the heat. Some warning signs of heat exhaustion are weakness or being tired, heavy sweating, paleness, muscle cramps, dizziness, headaches, nausea, and fainting. If you experience these symptoms, take steps to help cool down. Drink plenty of cool fluids, even if you're not thirsty. Avoid caffeinated or alcoholic beverages as they will dehydrate you. Take a cool bath or shower. Move to an air-conditioned space if possible. Heat stroke is the most serious heat-related illness. It's when someone's temperature rises rapidly, their sweating mechanism fails, and they're unable to cool down. Heat stroke is life-threatening and is an emergency. It requires medical assistance. The warning signs are red, hot, and dry skin, rapid, strong pulse, throbbing headache, dizziness, nausea, confusion, and unconsciousness. If you yourself feel or witness someone experiencing the above symptoms, get out of the sun, try to cool down rapidly with a cool shower or bath or spray from a hose. Monitor the body temperature, trying to get it down to 101 to 102 degrees Fahrenheit. Drink a cool, non-alcoholic, non-caffeinated drink and get medical assistance as soon as possible. Of course, preventing heat-related illnesses is the preferred to getting it in the first place. Here are some quick tips to keep yourself safe and cool during the heat wave. Drink plenty of cool fluids, even if you're not physically active, even if you're not thirsty. Avoid caffeinated and alcoholic beverages. Wear lightweight, light-colored, loose-fitting clothing. Add a wide-brimmed hat, sunglasses, and sunscreen, SPF 15 or higher. Limit physical activity. Stay indoors in an air-conditioned space if it's available. If you must be physically active, lower your intensity and take frequent rest breaks in the shade. If you must do work outside, try to schedule it during the early morning or evenings after it's cooled down. During the heat of the day, stay in the shaded areas. Monitor coworkers, ask them to do the same for you. Check on vulnerable people frequently. This includes the elderly, infants, and young children, those with medical conditions or those who are on medication. Use common sense. Make sure animals and pets have plenty of fresh water and shade. Consider bringing pets inside. Consider wetting down outside animals. Do not leave any person or pet in a parked car for any length of time for any reason. For more information, please check www.readyforwildfire.org and/or socoemergency.org. We do have a community question for the day. Is COVID-19 testing and the contact tracing process safe for our immigrant communities or other communities of color who may be concerned about engaging with the government? I assure you, the health department keeps your information strictly confidential, does not share it with immigration officials or other agencies. You may be confident about this assurance due to our strict compliance with enforcement of HIPAA, confidentiality agreements signed by all county staff, and process and systems that we have in place for securing and storing confidential information. We will not share your identity with any contacts you have identified. Stay safe and cool, Sonoma County. Talk to you again on Wednesday. Thank you.